Now to officially start our meeting, if you'll join me in the Pledge of Allegiance to the United States. I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Thanks for coming this morning, and I call this meeting of February the 24th, 2020 to order. And we'll start right with our agenda. B, approval of regular session minutes. Board, I know you've had the minutes for February 19th, 2020, our previous meeting. You've had time to review them. Have any changes or clarifications made? Do I have a motion for approval of the regular session minutes of 2/19/2020?
I move the approval of those minutes.
A second.
It's been moved and received a second. Roll call, Judy.
Mr. Humphrey?
Aye.
Mrs. Corcoran?
Yes.
Mr. Painter?
Yes. C, public participation. Is there anyone here today who would like to participate in this meeting who is a member of the public? We welcome your comments, and if you would like to do that, please raise your hand so you can be recognized by the president of the board. Seeing none, I'll close public participation, and we'll move to D, consent agenda. Board, a consent agenda has been prepared for you. I know you've had it early on Friday and had the opportunity to review it. Are there any agenda items that you would like removed from the consent agenda for further conversation or discussion?
No, thank you.
Okay, then I'd ask for a motion to approve the consent agenda as submitted.
I'll make that motion.
Second.
It's been moved and received a second. Roll call, Judy.
Mrs. Corcoran?
Yes.
Mr. Humphrey?
Aye.
Mr. Painter?
Yes. E, non-consent agenda. Non-consent agenda starts on page 5 with item 13. Morning, Mr. Dick.
Good morning, Commissioners. I'm Tim Dick, Director of Department of Job and Family Services, and it's my recommendation, with the concurrence of Thomas J. Eigel, County Administrator, to execute a 4D contract by and between the Department of Job and Family Services, Child Support Enforcement Division, and Legal Tenders of Ohio, located in Milford, Ohio 45150, for the provision of extensive case management in terms of conducting investigations to perfect location and service of process on child support enforcement's most difficult to serve cases at a rate of $24.75 per unit hour for a total amount not to exceed 1,838 unit hours based on the actual time worked, for a total contract not to exceed $45,500, effective for the period of April 1st, 2020 through March 31st, 2021, pursuant to and in compliance with the terms and conditions specified therein.
Board, you've heard the reading of item number 13. Do I have a motion for approval?
So moved.
I'll second.
Been moved and received a second. Any further conversation or
I
discussion?
have a question. Is this new?
This is not. This the 5th year, I believe, we've had a contract with Legal Tenders.
Okay.
So it's been very successful for our Child Support Enforcement Division.
Okay. Thank you very much.
Anything further? Roll call, Judy.
Mr. Humphrey?
Aye.
Mrs. Corcoran?
Yes.
Mr. Painter?
Yes. Item number 14.
Item 14 is a recommendation to approve and sign bond number 014217507 in the amount of $1,000 for Timothy Robert Dick as Director of the Clermont County Department of Job and Family Services, and subsequent thereto to authorize payment for the premium therefore in the amount of $112 to C. Edward Lovins Insurance Agency, located in Milford, Ohio 45150, with the reference bond to be filed in the office of the County Treasurer, pursuant to and compliance with sections 329.01 of the Ohio Revised Code.
Board, you've heard the reading of item number 14. Do I have a motion to consider approval?
I'll make that motion.
Second.
Been moved and received a second. Any further conversation or discussion? Roll call, Judy.
Mrs. Corcoran?
Yes.
Mr. Humphrey?
Aye.
Mr. Painter?
Yes.
Thank you.
Thanks, Tim. Item number 15.
This is our contract for healthcare services on the recommendation of Joseph A. Palmer, Jail Administrator, with the concurrence of Thomas J. Eigel, County Administrator, to execute the health services agreement by and between the County of Clermont and Southern Health Partners for the provision of adult inmate medical, dental, and mental health services at the Clermont County Jail in concert with the request for proposals for adult inmate medical, dental, and mental health services heretofore approved for solicitation by the Board of County Commissioners on December 3rd, 2019, pursuant to and in compliance with Section 307.862 of the Ohio Revised Code, being the sole proposal received, therefore on 12/26/19, with said services to commence February 24, 2020 through January 31st, 2021, and reference as the initial term with compensation for said services based on the 12-month annualized price of $1,092,204 during the initial term and payable in monthly installments accordingly, and thereafter automatically extended for additional one-year terms as defined in Article 7.3, titled Future Years Compensation, subject to county funding availability, unless either party provides written notice to the other of its intent to terminate or non-renew, with the compensation for said services to increase by 3% for the period of February 1st, 2021 through January 31st, 2022, and by 3% for the period of February 1st, 2022 through January 31st, 2023, pursuant to and in compliance with the terms and conditions set forth therein.
Board, you've heard the reading of item number 15. I would, before I ask for a motion on that, I would request a motion to table item number 15 for further conversation and discussion, and for consideration of rebidding this contract. The motion is to table it. Do I have a second?
I'll second your motion to table, getting further information out for bid. Is that what you want to do on this?
Yeah, this is, what we
Okay.
got was we just got one bid for this particular service. I've had an opportunity this weekend to review this contract in, very closely.
Okay.
There are, what I would call pools set up in this particular contract that allow, further compensation, and then the 3% increase that's included there would, allow the initial year to start at $1,092,200. The second year would go up $32,766. The third year would go up another $33,748.98. My consideration for tabling this particular issue is that, it's based on the contract is based on a particular outlay of X amount of people being at the jail. That really isn't the cost. The cost is how many people this company provides on this contract for a period of 2,080 hours per year. And then there are pools of money set aside for other items that are used in the medical field for the inmates, when I really think we could negotiate something that's just cost plus some type of small indirect rate for those kind of expendables. So my recommendation is to table it, and then I would want to see if we couldn't just extend the current contract we have on a monthly
gonna
basis
say,
or on a
I'll cover-
6-month basis to the time that we could get some competition on this contract to provide health and dental services to inmates.
So,
I have kind of a question, and that is, are there others that bid on other county contracts? What are Butler, Warren, our surrounding counties doing, and do they have the same carrier, helper?
Counselor, do we?
I think Mr. Palma would, I know he's talked with other,
I'll be more than happy to answer the questions.
Thank you.
Warren and Butler County, county-wide service through county employees.
Mr. Palmer, would you mind stepping up to the podium? I just want to make sure that the microphone catches what you have to say. Yeah, thank you.
The Commissioner Humphrey asked about Warren and Butler. They use county health services. By that I mean the county itself pays for so many county health nurses, so many county doctors to work. They're actually paid for on a county payroll for medical and dental. For mental health, They have a separate contract services in Butler and Warren County with a mental health service agency. I could not tell you, lady or gentleman, what that is, but that's how they work their contracts. This service is extremely difficult to find companies that provide the full service that Southern Health Partners have. From the time this was sent out until today, I have not received any phone calls from any other companies that are interested in any way to bid on this, like somebody saying, gee, we're late, we wish we could have bid. No, that's not been done. In 2005, Clermont County began a business relationship with Southern Health Partners. In the 15 years to today, there's only been one RFP ever sent out for health care. And I'd like to go on record to say, if it wasn't for the clerk of this commission, Ms. Kaseka, and the prosecutor's office, this has been going on for 2 years. This has been one of the most hardest things I've ever done as a jail administrator. These are just not done easily. And again, I want to sincerely appreciate when Ms. Kaseka took me aside and said, look, to get this done, it hasn't been done in a while, I will help you through it. And of course, I sincerely appreciate her efforts. And Ms. Nickel and her staff at the prosecutor's office have diligently worked with Southern Health Partners. It's an ongoing thing. So I'll be quite honest with you. Sending it out, again, under what I need, under the same need clauses that I put out for personnel, I do not expect any other bidders, because what we are requiring is National Correctional Health Certification. Few, if any, companies have NCCHC certification. We've always had it. I believe if I did not include that in the RFP, we would step down in quality of care, which I don't want to do. Another thing, I do not want to separate health care, the medical, from mental health, because what I could have is a situation where I've got a mental health official recommending one thing, a doctor at Southern Health Partners or whomever saying something else. I'm at a conflict. For an example, what if the formularies aren't the same? What if I can't get the medications that the mental health people say I need? The health provider says, no, we don't need that. We can only give this. I think that puts me in a precarious legal position and the county in a legal position. I don't know how much better I can do. If I'm asked to look into, of course, I will do what the commission asked me to do. I just don't know how much farther I could get with this. It took me 2 years to get to this point now, and again, without the help of these two ladies here, I could not have completed this RFP. They just are very, very involved and difficult to do, and they're not in high demand for people to come here. Because, for example, I don't want anybody from California. No offense, I've got to have somebody very close at hand that I have a working relationship with. I know Chattanooga, Tennessee is not around the corner, but within 24 hours, if I need something, I've always had it. And I would be more, I'm sorry, I've probably expounded too much and taken too much of your time, but I did want to be as thorough as I can, Commissioners.
Appreciate that.
I think
Appreciate that.
I think you're concerned about the mental health as something that was not, in my mind, was not weighed as it, but now you're explaining that connect.
And see, I'm getting more mental health. I'm getting 4 more hours a week of a mental health professional. Our mental health nurse, under my previous contract, I had 4 hours less. Now I'm getting 4 hours more.
All right.
40% of the inmates have mental health issues. Today's report indicates 37 to 40% have mental health issues. And mental health, that's why I'd want to join it, Commissioner, to keep them both the same, because they're so intertwined with psychotropic medications, et cetera. But that mental health would be it. Yes, ma'am.
Okay.
Let me ask one question about it, and I'll just get to the point. This is $1 million contract for the county, $1 million annual contract. they're a sole proposer, okay? And I'm going to just ask a question. Are they the sole proposer because they're the only person that proposed a bid? Or are they a sole proposer because they're the only people in this state or any other state that can perform this service? Because if this is a sole source justified $1 million contract, you know, which way is that? Are we just giving them this contract because they're the only one that proposed a contract?
They are the sole proposal received on December 26th. And if you would look in one of the
So let me
Oh, I'm
ask
sorry.
this question while we're here. Then how do we determine that the price that's proposed is fair and equitable for the residents of Clermont County?
Well, if you don't mind, if I could address a couple
Absolutely,
things.
absolutely.
You asked if they were the sole they were the sole provider, but I do also believe that there aren't a lot of companies that provide these services also, and Joe may be able to speak better to that if he knows. This isn't like a food service provider, like, you know, we've had other food services providers contact and say, hey, we'd like to propose bids. This isn't necessarily one of those situations. And if I could address something, and correct me if I'm wrong on that. I have worked with Southern Health in doing this. They're a very large company. You know, it's not as if they have 3 or 4 counties. I mean, and they're very professional. As far as the pricing is concerned, if I'm correct, if I understood one of your concerns was that there was a pricing based on prisoner, per prisoner.
And there were some pooled monies there that were like $130,000 pool that you can tap.
Well, the per prisoner, the reason that they break that down, and correct me if I'm wrong, is we are required by statute and by regulations the healthcare providers are required to assess every single inmate. So it makes sense to put a price on how many inmates are actually in our jail, because that's how many individuals are going to be seen. It isn't as if an inmate is only seen if they have an issue. Every single inmate is seen, whether I mean, they have to agree, but at intake. So, you know, that's one of the reasons they priced it that way. The pool is that, I think Mr. Palmer could probably speak to that more, is that when they go out of the jail?
It is the same pool that has been used since 2005. By that, I mean it has increased. The notion of the pool, yes. Southern Health Partners is responsible for so many 100,000 if they're sent out. Then after that number, we split it 50-50. Then after that number, it is solely the responsibility of the county. Since 2005, in all the renewals that we've had, and again, Commissioner, you are correct, we have only dealt with one company since 2005, that the pool, as Ms. Nichols talks about, has always been that way. The sums have increased, but they've been that way. Average med call, 140 inmates a day, including our intake, medical, mental health, and dental. Our package sees approximately 140 people a day. And again, in answer to your question, Commissioner Painter, the latter would be my answer, not the former. I like working with them, not because they're the only ones. As everyone has said, yes, they are the only bidder. I am, if I was asked my opinion, I'd like to see this accepted solely because of your second reasoning, sir.
You said that they cover a lot of county.
It's in the proposal, and it will show you, if you could pass that over, Tom, I'll be happy to flip it open for Mr. Humphrey. It indicates how many are in Ohio and then in other jurisdictions. They've provided the reference.
those that are
There's,
in Ohio.
yeah, as soon as it comes my way.
Got it.
They also are the only ones that are NCCCH certified, which is major, the criteria used to get that certification. That is what I would not ever want to remove from our RFP, because it adds to the quality of the care provided at the facility.
are many counties doing it the way Butler and Warren are, that hire their own personnel to be able to do this? Or are we unique, are we the exception or the rule in hiring a company?
The only other county that I know about, I know Adams County, uses the,
Okay, because here's where
county
Ohio.
health services.
Delaware,
The only reason I know that
Summit,
is
the
I-
alternative, and us. That's all that's in Ohio. And the correctional center in Northwest Ohio.
About split in Ohio.
Okay, so that's the only ones that
Go
I
ahead
have.
and tell
Here's
them
the-
that.
Okay, I will. In Ohio, the only, they provide to Delaware County, Summit County, the alternative county in Akron, the juvenile court, us, and then the correction center of Northwest Ohio in Stryker, Ohio, which I believe is in Northwest Ohio. And then they have several pages of, from Alabama to Wisconsin, that they provide. You can take a look at those if you're interested, but those are their current client list. But what they're providing to those, if we're talking about apples to apples, I have no idea. And I don't think they've just provided this as merely for us to contact, not to compare it to what we are asking for.
So just to compare apples to apples, when we're talking about countywide services like at Butler, is what I'm hearing is that Butler hires a couple doctors and they put them on the Butler County payroll and they man the jail?
Doctors are paid for by the county other than Commissioner Mental Health Services.
Okay, and then they subcontract for
That's
that?
correct, sir.
Okay.
And I believe they do the same for dental. I am not positive on that, though.
So on this particular contract, what's our coverage? What people actually work for this company in our jail and in how many numbers?
How many doctors,
I
how
don't
many
have the
nurses?
RFP before me, but the numbers that were stated in the RFP, which is also contained in the contract, quite a few. If Ms. Nichols has, I could review exactly how many people,
Just read
which
it.
is inclusive of 24 hours a day, 7 days a week, LPNs. We're picking up an additional RN on a part-time basis. We're picking up additional hours for our mental health nurse. They are listed there, Commissioner. I'm not trying to avoid your answer.
No, that's fine.
It is
And we're
a
not-
considerable increase because the population has considerably increased. As you can see, I used the number of 400. We're about 396 on average today, just using today's number. It's 401. I'm not trying to say I memorize them, which I do. But that's generally what we're looking at. Before, sir, it was judged at 325. The last contract, not renewal. See, that's all we've been doing is renewing them. And 2 years ago, the commissioner said, you know, you're sending, we want it sent out for an RFP.
Okay.
And I tried it on my own, was unsuccessful. And then again, through the help of the two ladies that I mentioned here, it was successful this time around. But we cut it right to the wire. I can remember Ms. Kaseka telling me that. Right to the wire.
So let me just talk about that a second, because I'm looking at the RP to make sure I understand it. On Monday and Wednesday, for 4 hours on Monday and 4 hours on Wednesday, there's a medical director / physician extender for 8 hours a week. On Monday only, there's a psychiatrist for 3 hours. On Tuesday, there's a dentist for 8 hours on Tuesday and Tuesday only. The big staff comes into administrative staff. There's a medical team administrator. They're 8 hours a day, 40 hours a week. There's a qualified mental health provider 4 hours a day for 20 hours a week. And an administrative assistant for 8 hours a day, 5 days a week for 40 hours. When it comes to support staff, there's an RN on days on Monday, Wednesday, and Friday for 8 hours. Then there's an LPN that's there 12 hours for 84 hours a week, an LPN in the evenings for 10 hours at 70 hours per week, and an LPN at night for 12 hours per night for 370 total hours per week. is what the contract is for. So, Joe, would it be fair to say that most of this is covered by the LPNs, 12 hours a day during days, 10 hours in the evening, and then an LPN at night?
The answer is yes, sir.
Okay. And then, a large load here comes from the medical administrative staff, which makes up for 100 hours of that 370 a week. But the professional staff, the medical director, the psychologist, and the dentist combined put in 19 hours a week.
The medical director also is Commissioner, the
physician.
doctor for the facility.
Okay.
Dr. Wallace.
Okay.
So he not only acts, he sees patients also.
Okay.
The biggest addition I asked for in this contract that was never asked for in the previous RFP that was sent out. There's only been one. I asked for an increase in RNs
Good.
because they're the only ones that can give the intake physicals. It's either an MD or an RN. I asked for that. I asked for dentist because of the dental problems inmates have, and I'm not picking on any in particular other than meth usage has a terrible effect on gums and teeth. I have extra hours for the dentist. A big thing, extra hours for the mental health nurse. And those were the extras included specifically in this RFP that have never been included before.
And let me just ask about the dental work. Let's just talk about some specifics on that. Is this dentist going to perform dental work here in our facility in the jail? Do we have a dental facility that is equipped with an autoclave and the ability to sterilize instruments and drills and that kind of stuff? I mean, do we have a room for that?
Not only that, Commissioner, we have an X-ray unit. The only thing we do not do is extensive work. Appointments are set up at a very low cost at the University of Cincinnati Dental School. We have a contract with them, Commissioner.
Okay.
But we are prepared to do extensive dental work right at our facility. Yes, sir.
Okay.
And extensive dental work means cavities and extractions and that sort of thing? Is
Yes,
that-
Commissioner.
Okay.
And then I just want to bring, we'll bring this thing to a vote here pretty soon. This cost pool accounting feature is $130,000 to $180,000. And SHP is the company we're talking about. They'll continue to provide a two-tier cost pool for the county to use. The first tier, $130,000, will cover 100% of the cost of renal dialysis, all prescription medications, clinical laboratories, off-site dental services, on-site x-ray services, and all medical and mental health services that cannot be reasonably performed on-site. Once the first limit of $130,000 is reached, SHP will continue to cover 50% of the cost of those services until the second tier of $180,000 has been met. The remaining 50% will be billed back to the county if the total budget amount of $180,000 is reached. In any year, any 12-month period, the county will be responsible to cover 100% of the excess costs through a reimbursement procedure. So let me just be, so this $130,000 that is in here is included in that $1 million cost every year. It has to be, if they're going to incur it. Because they're going to cover the cost of renal dialysis, prescription medications, clinical labs, and off-site dental services, x-rays, and all medical health services that cannot be reasonably performed on site. Once that first limit of $130,000 is reached, then they'll continue to cover 50% of the cost above that mentioned to $180,000. So let's just talk about that. For me to bid a contract like this in the fixed price world, I have to include $130,000 per year in my bid, and then I have to include another $50,000 per bid in my bid because I'm going to cover up to 50% of that 180. So I've got to include 25 more thousand to cover that. So $155,000 of this bid is contingency, and that's one of my issues. This is contingency that's being included in a fixed price bid. Instead of just covering the cost of the actual service and a reasonable markup, we're we're making a guesstimate and throwing $155,000 of county money at it, and we might spend it and we might not spend it. What I will tell you is that the fixed price contractor, they will bill for this money, no question.
Mr. Palmer has been, for the last, I want to say 2 years at least, has been providing us with a monthly breakdown of that exact pool.
Mm-hmm.
And so we base we have, it's not a guesstimate, is, I guess, my point.
It's a contingency.
It's a very educated, basis for a contingency.
So why wouldn't we handle that differently? Why wouldn't we just say that you handle the cost up to $130,000, and then 50% is second tier, and then once you get past $130,000, why don't we just handle the cost with a 10% markup on what the actual service is, instead of taking the chance that we spend it or we don't?
I don't think there's a chance of we won't spend it.
Understood. I mean, that's my reason for wanting to I'm just giving you the reasons for why I'd like to table it, but I've got two other commissioners here. I mean, we've had a motion and a second to table it. So what I would ask is this: let's just call it to question right now.
Well,
And
there's a little more conversation, I think.
okay,
We have a clause in here that says the party provides written notice of their intent to terminate. Does that have a period of time? Terminate
I'm sorry,
after
just reading
2
it.
months or?
Yes. Actually, that was one of the things that we had talked about. Originally, they were only giving,
In the RFP, it was only 60 days.
60 days.
it was only 60 days, and that was, when we actually went to the contract, that was one of the things that I did negotiate with them, to extend that out to 120 days, which would actually give us, if they decide that they want to terminate for some reason without cause, that gives us enough time to actually get together another proposal and find another organization. So there are other,
I was looking at this from the other side. If we decided to so I was thinking that we could accept this, rather than not have a contract at all, we could accept this contract. And if we decide that we need to do something different than this contract, then we'd have 120 days.
That's correct.
That
We
we'd
would
have to run after we decided.
We actually do have a contract in place until April 1. We've extended the existing contract until April 1, so we would not be without those services as they have been and provided by the same provider. I don't know what the cost differentiation is, but the motion also said until such time as this contract was awarded, the proposal was accepted and a contract executed.
correct. My understanding, though, by statute is, today is actually the last day.
It is the
because of-
60th day.
It is the 60th day to accept or award a contract under the prior request for proposal. So if it's not done today, we do actually have to go out.
For bid again, all over again.
Unless we would get something from the Southern Health today that indicates they're willing to extend their bid,
Right.
their proposal.
But,
Which-
in the alternative, as Mr. Humphrey indicated, we do have 120 days. There is a provision in the contract that we can terminate without cause. We would have to give them 120 days notice, but that's in there, which would allow us enough time to get proposals.
And explain what the proposed duration is. The specification we sent out, the duration of the contract was from February 1, 2020 to January 31st, 2021. And then therefore, this contract may be extended up to 3 more subsequent one-year terms upon agreement of the party. Is that what this does?
That is,
It does not.
Not exactly.
that's what the contract does now.
This current contract that you have before them, it's for 2 additional 1 years and then to go there and after unless either party terminates, is it not?
Correct, up to 2023, because we would have to go out for another, we're required to do request for proposal. We're required to look at our contracts and see if, there is anybody out there that wants to provide services.
I'm just pointing out that the general conditions that were given for the bid are different in this proposal.
Commissioner, my understanding was that we did identify that, correct?
Correct.
And that there is no longer an automatic renewal period after the
There's
2
no
years.
automatic renewal.
The automatic renewal is in this proposal.
It's in the contract, I think. It
Right.
indicates unless either party
I think it
gives
was
notice.
my understanding from Jenny this morning is that it was actually modified with them, and that it is no longer an automatic renewal after the first 2 years. Is that
But
correct?
that's not what we're being asked to sign.
Right.
I don't think.
That's what,
I have. Is that the one that you?
that's my understanding. I asked the same question, and then that was corrected.
We actually modified it to match the terms of the request for proposal. Which one is- So, section 7.3 has the future year's compensation for 2022 and then ending 2023.
But the motion we have here says, and therefore automatically extended for additional one-year terms as defined.
Meaning as defined,
In the contract.
it will extend unless either party terminates up to 2023.
I think initially, Commissioners, and if you refer to, the topic paper was not correct, which is why I spoke to Jenny Nichols this morning. It was written prior, the topic paper was written prior to the modifications, because the topic paper talked about after 2023, you can negotiate mutual agreeable terms prior to the beginning of each renewal period after 2023. And Ms. Nichols has indicated that that's no longer the provision in the contract, is that it stops at 2023.
Article 6 is identified as term and termination of agreement, and it says this agreement shall commence on February 19th, 2020. The initial term of this agreement shall end on January 31st, 2021, and this agreement shall thereafter be automatically extended for additional one-year terms as defined under Section 7.3, subject to the county funding availability unless either party provides written notice to the other of its intent to terminate or non-renew in accordance with the provisions of Section number 6.2 of this agreement.
And section 7.3 has the 2 renewal period compensations, but does not extend after that. So any reference to renewing after that was taken out of the contract.
I guess the only thing that I'd like to understand is we only have 3 counties that are doing what we're doing with Southern Health Partners,
2 in a
Two.
correctional.
2 in a correctional. What are all the other places do? What's everybody else doing? And if they're doing it some way, does it make sense for us to do it that way? I mean, if everybody's hiring physicians and mental health people and nurses and that sort of thing, doesn't it make sense for us to do what the majority of people are doing? I don't know.
I don't know what the costs are, Commissioner Humphrey.
I don't either. I mean, we'd have to dig into that.
Or what the services are, or
Yep, we'd have to specify,
something's happened in other agencies.
find out, and find those people to hire. And that would take a long time, so, I'm not sure tabling is I mean, that just puts it off to another day. I think we have to make a decision that we can move forward with this. Well, I don't see anything but moving forward with this personally, so, everything else would take a long time to put together unless we can extend existing contract on a month-to-month basis
We don't want to,
for up
The
to a year.
existing, the contract is now through April 1. The current contract is
Yep,
through
I
April 1,
understand.
okay? So,
One to get stuff together.
but this is the
we can't get
60th,
to the other.
this is the 60th day if you would want to extend this and either renegotiate terms and conditions or whatever, because my understanding in the RFP process, that you can, what we sent out and then what we negotiated is our prerogative
that's correct, an RFP.
with the vendor.
Right. So we could have, if we would table it with a condition or contingent upon us trying to get something from Southern Health Partners today, then we could go ahead and extend this so we don't lose the proposal. If we don't do that, we'll lose the proposal, back to
That's
square
true.
one.
At midnight, it's gone.
Right. So if we can get something from them today, that's another option for the board.
Rather than see about that and have a meeting late today to do that, I would propose that we not table the motion, instead vote on the motion and approve the motion, and that gives us some period of time to figure out what the others are doing, how they're doing it, and how it would compare to this price. And then we got 120 days to wait to terminate the contract, whenever we're convinced that the alternative is a better process than this is. I think we should approve this contract and move forward and work on it to ourselves.
Let me make sure we talk apples to apples. We currently have a contract with them right now. That contract is in place until April 1st.
Correct.
Can I extend that April 1st date beyond that if we choose as a board to do that?
If they choose to.
Right, if they choose to accept it.
Yes.
If
Okay.
they choose- If they don't choose to
When it
accept
comes-
it, then we don't have any healthcare services.
Right.
And
Right. So with this particular motion that's made today, this particular motion is from the request for proposal, their actual proposal that has been received, and this is the 60th day. The bids were only good for 60 days.
Correct.
Okay, so if I table this today and we call them back and say, we'd like you to extend this bid, they could extend this bid at least to April 1 or beyond.
Yeah,
Another 60
typically-
days?
Typically, we do what, 60 to 90 days when we
We,
extend
we,
proposals?
we've done them all the way to like 120 when it's necessary.
Okay.
The 60 is usually, and the statutory provision, and it's also what we put in this proposal. But in competitive bidding, it is 60 days. And then we have asked for 30-day extensions or 60-day extensions in addition. For instance, when we dealt with the credit card proposals, those went out and they were 90 days and then asked for an additional 60. And it wasn't our intent to go the full 60, but we were negotiating terms and conditions with two different companies for two different venues. And so it is not uncommon that we have done it.
So I'm just trying to put all the things that are together there. We could table this today. We still have a health provider services until April 1. We could go back to them on this proposal and ask if they would extend this bid for a longer period of time so we could further negotiate. And we could ask them, if we were to bump up on the April 1 date, do you have any problem with us extending that for another 60 days? Is
Yeah,
that,
we could do all those things. It depends, but then we're putting it in their court, so if they say no on the RFP, then we would lose the RFP. We'd have to go back out for proposal.
We have to make a
They would say
decision
no.
today.
healthcare
Sounds
services
like
in
we
the
have to make a
meantime.
decision
We would
today
all
on
the
the
way to April
proposal.
1.
But that.
We can do that, we can table it for now and
think
come
we
back
will.
after executive session, after people have made a chance to make some phone calls and see where we are then.
Yeah, we could try that. I don't know how receptive they would be to that, Joe. Do you have any idea how quickly you could get something from them?
No, I do not, sir.
They've been readily responsive to you, Jeanette, right?
And to Mr. Palmer, but their I don't know if they'll accept that or not. I don't know.
You can certainly try.
I mean, we can give it a try and we can pull it back off the table, right, after,
Yeah,
if that's what the board desires.
sure.
And the board could desire not to table it, you know, that's, we haven't voted on it yet, so, okay? Any further conversation or discussion? All right, Judy, we've had a motion and a second to table, roll call,
You made the motion, right?
I did.
And Claire seconded?
that's correct.
Was that correct?
I second it.
Okay.
But are we staying with the table now?
Mm-hmm. We've already moved it and seconded
All right.
it, so,
Unless we withdraw it,
unless you,
we have to vote on it.
Mr. Painter?
yes,
Mrs. Corcoran? Mr. Humphrey?
No.
okay. Item number 15's been tabled. Are there any additions, Tom, to the agenda?
Yes, sir.
Then we move to G, executive session pursuant to G1 and G3.
Yes.
Okay. G1 and G3 of the Ohio Revised Code to first consider the employment and compensation of one or more public employees, and to second, to confer with the prosecuting attorney regarding pending or imminent litigation respectively. Do I have a motion to go into executive session?
So moved.
Second?
It's been moved and received a second. Roll call, Judy?
Mr. Humphrey?
Aye.
Mrs. Corcoran?
Yes.
Mr. Painter?
Yes. We will move to executive session. We will return and we will conduct further business. Thank you. We are back from executive session. I'd like to call this meeting from executive back into regular session. There were no decisions made, no actions taken, and we'll move on with the agenda. Tom, are there any additions to the agenda at this time?
We have two personnel actions for the board to consider. One is in the Department of Job and Family Services, and the second is in the Department of Community and Economic Development.
Board, you've heard we have a request from the administrator for two add-ons for employee measures. Do I have a motion to add these to the current agenda?
I'll make the motion.
Second.
It's been moved and received a second. Roll call, Judy?
Mrs. Corcoran?
Yes.
Mr. Humphrey?
Aye.
Mr. Painter?
Yes, they've been added to the agenda and handle.
The first is the Department of Community and Economic Development, Gail Foley, Executive Assistant 1, salary increase, temporary supplemental pay, effective 2/7 of 2020.
Board, you've heard the reading of the request for supplemental pay for Gail Foley. As you know, we've lost a couple members over there. She's been having to fill in for the director and for the assistant director. So,
Yeah, she's trying to keep things going over there.
do I have a motion for approval?
So moved.
I'll second.
Been moved and received a second. Any further conversation or discussion? Roll call, Judy.
Mr. Humphrey?
Aye.
Mrs. Corcoran?
Yes.
Mr. Painter?
Yes. And the next one?
The second, I'll turn over to Tim Dick.
Good morning again, Commissioners. The
Morning.
second add-on is recommendation of Thomas J. Eigel to approve Tina Pocock as the DJFS Assistant Director as a rehire in a vacant position with the effective date of March 23rd, 2020.
Board, you've heard the request for a rehire. Do I have a motion for approval?
I'll make that motion.
Second.
Been moved and received a second. Any further conversation or discussion?
Just note that Ms. Pocock would be returning to Clermont County. She previously worked for Clermont County Children's Protective Services Division and started in 2008. Ms. Pocock does have a bachelor's degree from the University of Cincinnati with a degree in sociology, as well as a master's degree in social work from Northern Kentucky University. So she had left the county to go to a neighboring county in 2018, so we'll be glad to have her back and leading the Children's Services Division.
She'll be in charge of Children's Services.
She will be, yes, she'll be the Assistant Director specifically over Children's Protective Services.
What date was that?
The effective date would be March 23rd.
Thank you.
Anything further?
None.
Roll call, Judy.
Mrs. Corcoran?
Yes.
Mr. Humphrey?
Aye.
Mr. Painter?
Yes.
Thank you.
Anything further, Tom?
Yes, sir.
With no additions to the agenda, I would go ahead and, I'll take H, county elected official discussions or county staff. Anyone here from the staff that has any conversation or request for the board? Then I'd close that portion, and then I would move to recess this meeting until 1:20 PM this afternoon.
So moved.
A second?
It's been moved and received a second. Roll call, Judy?
Mr. Humphrey?
Aye.
Mrs. Corcoran?
Yes.
Mr. Painter?
Yes, we will stand in recess until 1:20 PM. We will return and we will conduct further business. Thank you. I'd like to call this meeting from recess back into general session. And I am asking that we return to executive session.
You want to cite that?
21.
I'm gonna have to.
22G4.
You want to cite it, Tom?
Executive session pursuant to Section 12122 G3 to confer with the prosecuting attorney regarding pending or imminent litigation respectively.
Do I have a motion to go into the executive session?
So moved.
A second?
Been moved and received a second. Roll call, Judy.
Mr. Humphrey?
Aye.
Mrs. Corcoran?
Yes.
Mr. Painter?
Yes. We will proceed into executive session. We will return and we will conduct further business. Thank you. We have returned from executive session. There were no decisions or actions taken, and we are back into regular session. We left off with county staff elected officials before we went into executive session. Tom, are there any additions to the agenda before I move on?
Yeah, we have an addition to the agenda for the board to consider a request to extend the expiration date for the disposition of proposals heretofore received for the county to provide adult inmate medical, dental, and mental health services.
Board, you've heard the request for an addition to the agenda. Do I have a motion to add that agenda item?
I'll make that motion.
Second.
Been moved and received a second. Roll call, Judy?
Mrs. Corcoran?
Yes.
Mr. Humphrey?
Aye.
Mr. Painter?
Yes.
The add-on is a recommendation from Joseph A. Palmer, Jail Administrator, with the concurrence of Thomas J. Eigel, County Administrator, to approve the request to extend the expiration date for the disposition of proposals heretofore received on December 26, 2019 for adult inmate medical, dental, and mental health services at the Clermont County Jail from Monday, February 24th, 2020 through Friday, April 24th, 2020, to provide additional time to continue the review and evaluation of the proposals therefore.
Board, you've heard the reading of the add-on to extend the proposals for Southern Health Partners. Do I have a motion for approval?
It's the RFP that we're just extending the deadline to
Correct.
come to an agreement.
Correct. The request for proposal.
So moved.
A second?
Been moved and received a second. Any further conversation or discussion? Roll call, Judy?
Mr. Humphrey?
Aye.
Mrs. Corcoran?
Yes.
Mr. Painter?
Yes. Anything else, Tom?
In regards to that extension, does the board wish for us to review the other counties in Ohio to see exactly how they're providing those healthcare services, to see whether or not they have county employees, whether or not they're contracted services? Is that the information that the board would like to have?
Yes.
We would. I think on my behalf, that would give me some information to really actually compare the proposals and find out how other counties are doing it. But one of the things I just wanted to throw out there is that my intention is that we provide good health services at our correctional facilities and that we provide good dental services. I mean, that's what I want to see. And I want to see it at a competitive cost and with a quality service. And I don't think there's anything different desired by this board than that.
Including mental health services?
Yeah, including mental health services, absolutely.
So we got, yes, because mental health's a big part of our jail population, I think. And so, Tom, when you review that, will you include each of the aspects, dental and mental health?
Yeah, because I think Mr. Palmer had indicated a couple of them hire or contract with county employees or employees.
And how
But
much
mental
that
health
might
is-
cost versus what this might cost?
Yeah. So I'll separate, we'll make sure it's separate, so it's
Okay.
dental, medical, and mental health.
Okay.
And if we find that out, we put together a spreadsheet with the name of the county, the population, and what they're paying for each of those services, or?
Yeah, and we'll
And the
pay
total?
special attention to their jail population.
Yeah,
So it's
it-
comparable.
Absolutely.
Yep.
Absolutely. And I know just the thing for myself reviewing them, the things that, got me really asking questions about that was that, I think we can all agree that when you hire professional services, those professional services are available in your facility for whatever those hours are that there need be. If that's 2,080 hours a year, that's a fixed cost. And if what you need is 2 people or 3 people, you know what your costs are. And then when it comes to expendables, whether you write prescriptions or you use items, gauze, general medical items, well, then those are usually billed at some cost plus some indirect cost. And then when it comes to mental health services, whether you use your mental health services we have available here in the county, or whether we go out and contract for those services. Dental is another issue. Do we man a dental facility in our jail, or do we have local dentists here that those inmates can be delivered to that can provide those dental services like they do at Ohio State? So,
And I think also.
just a lot of questions there.
Yeah, I think we had the data on the pooled costs too, so I can get those to you as well.
Okay.
How often those are utilized, whether we're meeting that cap, and how often.
Okay.
Yeah.
Okay. Anything else? Then I'll move to member comments. Board members, any comments today? Anything else you'd like to include in the meeting?
Nope.
Okay. With that, I would ask for a motion to adjourn today's meeting.
So moved.
Second?
Been moved and it's received a second. Roll call, Judy?
Mr. Humphrey?
Aye.
Mrs. Corcoran?
Yes.
Mr. Painter?
Yes, we stand in adjournment. Thank you for participating in the meeting today, and thank you for those who are at home watching on cable television. We will see you this coming Wednesday. That would be the 26th, is that correct?
Yes.
All right. Thank you and have a great day.